Alrighty, everyone, we're going to go ahead and get started. I am Jasmine Morrison. I am an intern here at Six Dimensions. I just want to say thank you, and I'm sorry, Tierney Marshall.
Hey y'all.
We both just want to say thank you all for joining us today. This particular talk today, we'll be talking about contraceptives and the importance of it, whether that's biologically as well as socially. We do believe that contraceptives is a necessity for certain areas, whether you feel like you need it or not. We do feel like it is important to have easy access to contraceptives, not just on a local level but nationally. So we're very excited to have Miss Tyler Harden here, who's here with Planned Parenthood. She is the state director, excuse me, I'm gonna put some respect on her name, of the state of Mississippi. And then we also have Dr. Shantele Bolton. She's a obstetrics and gynecologist here in the state of Mississippi as well. And so I won't say too much about them because we have bios and we have, it's gonna be in order. So I wanna first kind of just talk about who Six Dimension is. So Six Dimensions is a woman-owned, minority-owned public health company. We do health research, development, and practice agency. We focus on supporting better health outcomes for all people and communities by creating strategies that address systematic inequities. We're committed to health equity and social justice as we work to create a healthier communities. Excuse me. So we utilize an ecological approach to developing solutions and strategies to improve the health of communities. We are invested in conducting and ensuring equitable community-based research, grounding our practice in evidence, advocating for equity policies that will yield a systematic change. And so me and Tierney, we focus on we're focused on really this series in which it is to kind of talk to women who are from ages 18 and 25 on various issues, but we want to kind of bring it back to health equity and community engagement. We believe that a lot of our health outcomes will improve through the work of advocacy and community engagement. So with that saying, I'm going to kind of give it over to Tierney, and she's going to kind of go more in depth of what this series is about.
Hello, everyone. I am Tierney Marshall, as Jasmine said, and I want to welcome you all to our Dear Young Women series. We hope that something is said or that will inspire you and encourage you to advocate for yourself and to know the truth about contraceptives. I want to say thank you to our guests, as Jasmine said. So about the Dear Young Women series, the Dear Young Women series is dedicated to the unique perspectives and journeys of young women navigating through adulthood. This segment is called Let's Talk Contraceptives, where we will talk to two professionals on what contraceptives are, and debunk myths that we've heard since we were younger that try to discourage us from contraceptives. So we are so glad to have our speakers here. And also, if you have any questions, can you please put them in the chat? If you have any comments, you want to say amen, put them in the chat as well. We are so glad to have you all here on this discussion. So we're going to start by introducing our speakers. And we're going to hand it to Chance.
I'm actually going to hand it back to you because I don't have access to Tyler. So you can read that for me. I appreciate it.
Okay. All right. So I'm going to start with our first speaker, Ms. Tyler Harden. Just pull up, please. Tyler Harden is the Mississippi State Director for Planned Parenthood Southeast Advocates and reproductive health and rights organization that is a reproductive health and rights organization, that is committed to protecting access to reproductive health care, including abortion. Tyler is an alumna of Jackson State University. Her hobbies include, I'm from Alcorn. Her hobbies include writing poetry and fiction, exercising, cooking, and all things that feel good. Tyler is a native of Hattiesburg and is an organizer and artist, and she's fly, and she calls herself a fly young Southerner. Can't be mad at that. Now I want to introduce our second speaker. This person is special to me and has been special to me since I was 18 years old. She is my doctor, Dr. Shantele Bolton. Dr. Bolton is a board-certified obstetrician gynecologist at the Women's Pavilion of South Mississippi. She is from Richton, Mississippi, and now currently resides in Hattiesburg, Mississippi. Dr. Bolton attended Jones County Junior College prior to graduating summa cum laude with a Bachelor's of Science degree from the University of Southern Mississippi. Dr. Bolton completed medical school, followed by an obstetrics and gynecology residency at the University of Mississippi Medical Center. She says it has been an honor for her to return home to care for the women in the Pine Belt throughout some of the most important stages of their lives. Dr. Bolton treasures fostering lifelong relationships with her patients, their mothers, and their daughters. Her professional interests include contraception management, high-risk obstetrics, minimally invasive surgery, and evidence-based medicine, as well as patient and community education. In her personal life, she enjoys church, cooking, concerts, sports, and traveling with her husband and her daughter, her adorable daughter. We want to welcome both of our speakers.
Thank you.
Yes. So before I kind of get into the depth of it, do you guys have anything to say? Any kind of like preview that we missed that you want to give to the people before? Any disclaimers, comments, concerns?
I think Tyranny covered it all for me.
Okay. All right, sounds good. So to kind of start off this conversation, I think it's important to lay the foundation of what contraceptives are. As I talked to you, Dr. Bolton, earlier, I'm very interested in the science of it. And I think that for a lot of people, particularly young women, we sometimes can lack the biological understanding of contraceptives, whether that's how they work in the human body, what they do, the effects. So can you first discuss the different forms of contraceptives and then the biology of how they work in preventing conception?
Yeah. So can you hear me okay? Okay, great. So there are several forms, of most of you probably know, several forms of contraceptives. And some of them include hormonal and some are non-hormonal. With the hormonal ones, there's something that we call combined hormonal contraceptives. And all that means is that it has both estrogen and progesterone hormones in them. The combined hormonal methods, so they release estrogen and progestins into your whole body, and they work by preventing pregnancy by essentially stopping ovulation. And ovulation is when an egg is released from the ovary. But they also cause other changes in the body that help to prevent pregnancy, such as causing the mucus from the cervix to become more thick, and that prevents sperm from getting through, leading to fertilization. So those are the main two ways that hormonal contraceptives work. Something else that people may have heard of are like the implants or IUDs. The implant is a rod that goes in the arm, just under the skin, and it is a progesterone only medication. And it also works by inhibiting ovulation. IUDs are little T-shaped devices that go inside the uterus. Those don't really inhibit ovulation. It mainly works in the inside of the uterus. So it's going to increase cervical mucus, and it's going to also thin the lining of the uterus. And those things also make it less likely for a pregnancy to implant. So that's mainly the biology of how those things work. What was the other part of your question?
I think it's like you talked about it. Can you discuss the different forms of contraceptives?
Yeah. So when we go back to combined hormonal contraceptives, so there's the pill, and with the birth control pill, you take a pill same time every single day. It's very effective as long as you do your part. And so with what we call typical use, only about 9% out of 100 women will get pregnant from the pill. And when we say typical use, that means that they're not taking it at the exact same time every day. Now, for people who have perfect use, less than 1% of those women get pregnant. So that's the pill. Take it same time every day. It's very effective if you do your part. The next combined hormonal option would be the patch. So it's a patch that you place on your skin, and you do it weekly for 3 weeks. And then the 4th week, you take it off. That's typically when you have your menstrual cycle. And you do that continuously each month. It's very effective. Again, if you apply your patch when you're supposed to and take it off when you're supposed to. Sometimes it can be more effective than the pill because it doesn't depend as much on you taking something at the same time every day. You're more likely to be compliant if it's just a weekly thing. The next thing would be the NuvaRing in terms of combined medicines with both estrogen and progesterone. The NuvaRing is a vaginal ring. And sometimes the younger girls get really freaked out about this because I'm like, yeah, you got to place it in your vagina. but it's very, very effective. It's only once a month. So you insert the ring vaginally and it stays in for 3 weeks. The fourth week, you take it out for a week and you repeat that monthly. Again, compliance is very high because you only have to remember to do something once a month. And a lot of people like the NuvaRing because you're less likely to have what we call breakthrough bleeding. And that's just basically when you have spotting, but it's not time for your cycle to come on. That's less likely to happen with a NuvaRing. So it's a really good option for people who've been on the pill or who've been on the patch and they just bleed throughout the month unpredicted. The NuvaRing would be a good option for them. The Depo shot is another option. It's a progesterone only medication. It is an injection and you get it every 3 months. Depo is hit or miss. Some people love it, some people hate it. The most common complaint that you'll hear about Depo is weight gain. There are people who say they gain 30 to 50 pounds on the Depo shot, but from a evidence-based medicine standpoint, the studies were associated with a 5-pound weight gain. But you will see people who swore that the Depo made them gain tons and tons of weight. And I believe that, but I think the mechanism is a little bit different. I think that it's because the Depo can increase your appetite, which leads you to eat more and more calories. That is what leads to the weight gain, not necessarily the medicine itself is putting fat cells on you. But it is a great contraceptive in terms of preventing pregnancy. It's just you have to weigh the side effects that can happen. Some people love it. They don't have weight gain. They don't have crazy bleeding, and it's great for those people. But then you do have the people who have the weight gain or people who have crazy bleeding, unpredictable bleeding for weeks at a time, and it's just not worth the side effects for them. The next thing would be the implant in the arm. That is called a Nexplanon. It lasts for 3 years. It is also a great contraceptive option. It's the most effective. Even when we talk about tying your tubes, getting a Nexplanon is more effective at preventing pregnancy than getting your tubes tied. People are like, really? But yes, based on the studies, that is, Nexplanon is more effective. It's kind of similar to Depo in terms of the side effect profile. People with the Nexplanon can have the irregular bleeding. That's the most common reason that people get it taken out before the 3 years. It's because they're just tired of the crazy, unpredictable bleeding. But some people are like, I'll deal with this bleeding as long as I'm not going to get pregnant. So again, you have to kind of weigh the side effects of it. And when I get somebody who wants a Nexplanon, I'm sure to counsel them like, you can have crazy bleeding and just know that, that is a very, very common side effect. And I think when people know what to expect, they tend to be more compliant with it because they're like, okay, she told me that was probably going to happen. The next thing would be the IUDs that I mentioned. There are several IUDs. IUDs do not have estrogen, so they are not a combined hormonal method. They have progesterone only, and then there is the copper IUD that has no hormones in it at all. Depending on which one you get, they last different time spans. So the Kyleena is a 5-year device. Liletta is another one that lasts for 6 years, I believe. And Mirena is one that's very, very common that most people have probably heard of. It now lasts for 8 years. And then there's the copper one that's non-hormonal that lasts for 10 years. IUDs are great, and for people, especially college people who definitely don't want kids for the next 5 to 10 years, who's stressed, who don't want to have to remember to take something every day or go get my shot every month, who just want to not worry about contraception. IUDs are very good for those people. I'll get into one myth is that a lot of people feel like you have to have had a child before you can get an IUD, or you have to be sexually active before you can get an IUD, or you have to be 21 and older. None of those things are true. I have put IUDs in 15-year-old girls who were virgins because they had heavy periods, and birth control helps with your periods as well. And those ladies have done fine. So IUDs are really, really good options as well. There are some other, some newer contraceptives that are not tried and true just yet. So there's like a film that dissolves in the vagina and you just use it with each act of intercourse, but it's not as effective. And it can lead to vaginitis, vaginal discharge, irritation. And then there's also a new vaginal ring that lasts up to a year now. Any other questions?
No, you covered
That was
everything.
a lot.
No, like at first I was taking notes and I was like, you know what, I'm gonna be present. I'm gonna watch it back later on.
Mhm.
But no, and I'm glad that you gave it all, because from the looks of it, it sounds like that that each method, I guess we can say, goes like, or can connect to different women. And so I guess my next question would be, we as you can see now, contraceptives is not a one size fit all.
Right.
So in your experience, how do you suggest women start or navigate finding the best method for them?
Okay. I first start by acknowledging what their medical conditions are, because that's gonna kind of help, for one, weed out certain contraceptives. For example, people who have uncontrolled hypertension don't need to be on a medication that has estrogen, because estrogen can increase your risk of blood clots, stroke, heart attack. So that's going to help me guide my counseling. So if you're someone who has hypertension, I'm going to say we need to stick to progesterone only medication. So I start there to see what is safe for this person in the first place. And then I like to get an idea of what they know about contraceptives and just kind of, tell me what you know, what you've heard, what do you think you're interested in? And we talk about those things. And then just kind of get a feel for what's your lifestyle. Do you want to take something every day? Do you think you may want children in the next year and don't want to be on something long term? And so it's really just a shared decision-making process it's very individualized, to find out what fits their lifestyle, what's safe for them, and just kind of what they think they would like. Oh, I can't hear you.
Muted. I feel like I wrote this question later on in my notes, but do you feel that there's a particular method that goes for 18 to 25-year-olds or young women?
Not all of them.
Not all of them. Okay.
Like all of them would be great for that age group.
Gotcha. Okay then. Okay. And so now that we're on like the topic of young women, and we know that living in Mississippi, we know the reality of what it's like to access contraceptives, whether that's insurance or whether that's, I know in my experience that there has been certain physicians who won't prescribe contraceptives. So can you kind of touch on the different ways women can access those, contraceptives?
Of course, your family medicine clinics, your OBGYN clinics, for people who are like definitely college age kids or young women, your school campus clinic, the health department, Planned Parenthood. So all of those should be avenues to access it. There really shouldn't be any barriers. I know that there are, and I know that there are some providers who impose their own personal beliefs when it comes to managing patients, but that's just not right. It just shouldn't be that way. So anybody in the surrounding area, you can always come to me, and I'm going to hear you out.
Yeah, I'm gonna throw it to you next.
Okay, so all right, because we're all just looking around. So as healthcare progresses, we've seen contraceptives become somewhat more accessible. However, that progression is only seen in certain communities. So this question is for Tyler. Can you give an overview of what contraceptive deserts are, and do you feel as if it is negatively impacting our age range or a specific age range or demographic of people?
Yeah, so I'm gonna back up a little bit. Every 10 years, there is a survey called the census that evaluates how many people live in a certain area. And it's kind of like an estimate of the population of folks who identify as men, women, children, based off different demographics, races, things like that. And a lot of times that data is used to drive research and to keep up with health disparities and things that impact different communities. So when we talk about contraceptive deserts, we're talking about counties or areas within our state where there aren't enough providers who are providing the full range of contraceptive services for women and for folks who may need care. So like Dr. Bolton talked about a little bit earlier, there may be doctors who have bias towards certain methods and don't necessarily prescribe those, or there may be a lack of funding. And so different counties across our state may not have access to the health department. Or I know if you're in Forest or Lamar County, the health department in Forest County offers contraceptive or family planning services 2 days out of a week. So things like that create barriers and make it hard for people to be able to access the full range of contraceptive care. And when we talk about who that impacts most, we're talking about folks who look like us and who live lives like us. We already face all the other barriers when it comes to healthcare, like cost, like accessing doctors who listen and care, and just examine our full range of all the things that we need. So it definitely impacts folks who are young, people of color, women of color, folks who live in rural communities, because Mississippi is also a state that has yet to expand Medicaid. So we don't have as many medical providers and medical clinics as we're supposed to. Yeah, and it also just impacts young folks in general. And on top of that, when we talk about just what it means as far as contraceptive care, just all the issues that link all of us back together, it's just another way in which our state continues to fail folks, because there's been at least 4 legislative sessions where we've been trying to get the legislature to pass laws that allow doctors to prescribe 12-month prescriptions for birth control pills, but that's not the reality for folks here in Mississippi. So those contraceptive deserts, it all leads back to the census, and it all leads back to just the legislative folks failing the people that they're supposed to serve.
Thank you so much. The next question is for both of you. For women who do live in these rural areas and in these contraceptive deserts, how can they go about accessing contraceptives and advocating for themselves?
Are you Dr. Bolton?
Sorry. Okay. From a physician standpoint, for instance, for people who don't have access to go to the doctor or for whatever reason, there are like online prescriptions that you can do. There's like virtual visits where you can have a visit virtually and that person can give you a prescription. So that's one avenue.
Yeah, and another avenue, oftentimes accessing requires traveling for people who live in rural communities. And as far as advocating for what they need and how they can access care, a lot of it is just making your voices heard within your community, talking to your legislators, talking to folks that are supposed to serve as you. And also just as Black women and women of color in general, making sure that we pass information to each other. So I know that Dr. Bolton is in Hattiesburg and I'm from Hattiesburg, and I have friends who may need healthcare and need advice on how to access contraceptives. So it's important for me to share the information that I know now to my friends, and for them to share that with other people in their network. So a lot of it is just really us taking care of us at the end of the day.
Thank you. This question is for Dr. Bolton. So you've been my doctor since I was 18, but we understand that everyone doesn't have a good doctor like you. So how can we talk about advocating for ourselves? What kind of, because sometimes we as young women, we don't know what to ask. In those moments, we're kind of scared, and you do a great job of helping. I know I've been in those situations. So how can we go about asking those questions and knowing what to ask and how to choose a great doctor and advocate for ourselves?
I think it's important before your visit to write down questions, because once you get in the room, a lot of times the doctor is saying a whole lot of information, and you may have had this whole list of questions in your mind, and then your mind just goes blank. So I think before your visit, know what the purpose is, like why are you coming to the doctor, and write down what you want to get from that visit. Like what issue are you having? What do you want to address? Do you want to talk about birth control? And literally write it all down. And any good doctor should be happy to answer those questions. Your doctor should not make you feel rushed. They shouldn't make you feel like it's a dumb question. They shouldn't belittle you, or just, it should be a back and forth conversation, and they should be happy. Like if you don't agree with something that the doctor says, your doctor should be okay with explaining what their recommendations is, or addressing what your concerns are. Because I know that a lot of patients that I have seen felt unheard, felt like they couldn't ask questions, they couldn't get an understanding. So that's the other thing. The provider that you're seeing, if you're getting the sense that it's not a shared decision making, they're not hearing you, they're not answering important questions that you have, then that's a red flag. And that means that you need to find another provider. Another thing is, I think it's a good idea to bring somebody with you, whether it's a trusted family member, a friend, just an older person, somebody who can be present and also think of other things that you may not have thought of to discuss with your provider.
Thank you so much. So this next question is for all of you. We know that civic engagement is essential when it comes to the increase in access of contraceptives. What are some things that young women can do now to broaden the access?
Voting. Y'all said it. Voting, definitely knowing who your legislators and who your city council people are. Even taking it back to like members of the school board, because if you grew up attending public schools in Mississippi, you know that we really don't have the best fact-based sex ed in our school. So a lot of times you're not even learning about contraceptives and how to prevent pregnancy. You're just learning not to have sex. So being aware of who all of those people are, making sure that if there's an election, even if it's for where we're going to put the next stop sign, just voting in every election you possibly can, making your voices heard, taking advantage of opportunities like these to learn more. If you're on a college campus, connecting with different students and pushing even your administration. I know at Jackson State for a long time, our health center didn't have the full range of contraceptive services. So it took a group of students pushing and meeting with administration to be like, hey, we need these services in order to make sure that we have the best college experience. So just getting involved, being aware, creating community, and not being afraid to ask the hard questions and do the hard stuff is what's going to get us to a place where we have better access to contraceptives.
I don't have anything to add. I think that was perfect.
So Tyler, I do have a question, because, and I had talked to you about this, about how I have little knowledge about Planned Parenthood, because, in other states, they're very, common, but in Mississippi, we only have one clinic. So can you kind of talk about, what does Planned Parenthood provide for women from all backgrounds, but, young women 18 and 25, and then 2, can we ask for contraceptives through Planned Parenthood?
So for 2, yes, you can definitely ask for contraceptives through Planned Parenthood. And I also want to bring up another form of contraceptives that we haven't talked about today, the emergency contraceptives. That's not something you should use long term, but it is something that can get you out of situations if you find yourself in them. We have them at our health center for $5, Plan B. And if you're someone who is over 180 pounds, Ella is the other form of emergency contraceptive that works best for you. And we also have that available at our health center. But Planned Parenthood in Mississippi, we provide family planning or contraceptive services, STI testing, If there are folks living with HIV or trying to prevent HIV, we have treatment. We also have PrEP for folks. We're about to join the Title 10 network, and that's the federal program that just gives different clinical providers money and support to make sure that everybody within a certain county or geographic region can access family planning and contraceptive services for free. So we're about to join that program. So a lot of our services will be, they're already reduced costs, but a lot of them will now be free because of that grant. So that's a little bit of the work that we do at Planned Parenthood as far as on the healthcare side. We also still, even with Mississippi's laws that prevent folks having abortion, we do counseling to make sure that folks can travel out of state to access that service if they need to. So we're an overall healthcare provider for reproductive health and just wellness in general. And if you have any questions, we have pamphlets around sex ed, even if you just want to figure out how to talk about sex. There's a lot of stuff that we do. So yeah, I hope that answers it.
No, it does. It definitely does. And at this point, I'm going to ask 2 more questions that I did not clear with y'all. So hopefully I don't throw you off a little bit. But this one should be a little simple. But so I know from my end, I have insurance and I do take birth control. And I know it is free for me. But for those who don't have insurance, is it free for them? And how can they find, if not, how can they find affordable contraceptives?
So it currently isn't free at Planned Parenthood. It's $20. And we give you a 3 months supply of pills. And if you do the IUD, we do that for $20 too. If you do the shot, that's $20. But it's $20 currently. When we join the Title 10 program, it'll be free. In the meantime, free healthcare providers, if you are in the Hattiesburg area, the health department, when you can schedule an appointment. There's also, if you're in the Jackson area, the medical mall, when you can schedule an appointment. There's other folks, the Open Arms Clinic is in Jackson and Hattiesburg now, so folks can access care there for free as well. But those, Mississippi, as far as options and places where people can access free care, we have to do better, but that also just speaks to the lack of support that we have from our state as far as funding and support around contraceptive care. So not too many places, but there are some.
And then this next question, Tyler, and Dr. Bolton, you probably can speak on it too. But have you guys seen any, because I feel like there are, but have you guys seen any health equities when it comes to women at first accessing contraceptives, but as well as being able to consistently take contraceptives? Hopefully I asked that right.
I touched on it a little bit earlier. I do see health equity, and mainly I think it's because of just provider bias in terms of the type of contraceptive that they're willing to provide. That goes back to like the IUDs. And I've seen where, there may be a 14, 15, 16-year-old girl who's sexually active, who is seeking contraceptive, and that provider will not provide it because they don't feel like that person should be sexually active. So, and that's something that providers have to do better without, providing unbiased care. So in my world, that's mainly where I see the equity issue.
I also see it as just like what Dr. Bolton was saying around stigma from providers, and also just patients and people who live lives like us. Like I know growing up, there was a lot of stigma around the time. I don't know if y'all remember this, but there were these billboards that popped up around like metropolitan cities like Atlanta and Philadelphia and New York. And it was basically like the most dangerous place for a Black baby is a Black woman's womb. And then around the same time, there was a lot of stigma around birth control and just like, girl, if I take this, I'm gonna get fat. And if I do this, my skin gonna break out. So it's just like a lot of stigma that creates a health equity, because a lot of times we aren't able to access the information that we need to be able to make decisions about what method is best for us. Again, like Dr. Bolton said, there may not be like a one size fits all type of method, but there is a method out there for everybody who wants to be able to access contraceptives. So it's a twofold thing for folks in our community. It's some provider bias, but it's also just stigma that impacts Black folks in a way that may not impact other communities.
I have a question for Dr. Bolton. So recently I've been seeing on social media where people think the emergency contraceptives that Tyler spoke about are abortion pills. Can you speak on that?
Yes, the answer that it is not. It's not an abortion. It is not going to end a pregnancy that has already occurred. It works by, it's a the pill is a high dose of progesterone essentially, and it's going to inhibit pregnancy from happening. And the other form of an emergency contraceptive is the copper IUD. And so if that is inserted within 5 days, it's going to inhibit pregnancy from occurring. It is not going to interrupt a pregnancy that has already taken place.
Thank you so much.
And actually, while we're on that emergency contraceptives, and this is my last question before I'll keep throwing y'all off. But Tyler and Dr. Bolton, with the recent policy change when it comes to abortion, will the emergency contraceptive be affected by that policy? And is there any other policies currently being, I guess, presented that will inhibit that? Or I guess
Not currently, but we have legislative session coming up in January, and our legislators, for one, don't know the difference between an abortion pill and Plan B, so they do think that emergency contraceptive can end the pregnancy. And two, our Attorney General has already said that she plans on creating legislation or supporting legislation that basically limits our access to emergency contraceptives and to contraceptives in general, like how we access birth control and things as we know it. So we won't know what those bills look like until January. So the short answer is, for now, it doesn't impact Plan B or any contraceptive services that we have here in Mississippi. But after the legislative session, we don't know. But if you have friends in Tennessee and Louisiana, they've already been impacted by the laws and legislation that limit their access to Plan B. So we got it okay for right now, but we won't know until after legislative session what the long-term impact will be.
Gotcha. And just to be clear, you can purchase Plan Bs through like your local drugstore, but can you also get it from your physician?
Yes.
Okay. Okay then. And do you do or do need insurance for that?
No.
You don't?
You don't.
Okay. Gotcha. All right.
You don't need a prescription either.
Prescription, yes. Okay. Sounds good. All righty then. Well, that's all of my questions. That's just been popping off my head. But we would like to open up the floor for anyone who has any questions. You can unmute yourselves, or you can write in the chat. If Tyler or Dr. Bolton want to kind of give any extra comments, things they want to say that we did not bring up, please feel free. I'm interested in hearing it all.
I do want to say, because I just kind of mainly talked about preventing pregnancy, but one thing we didn't talk about is none of those contraceptive methods prevent infections. So for those who are sexually active, you still need to use barrier protection with condoms. So I just want to make sure that that is clear, that those are great at preventing pregnancy, but we still need to use condoms too.
Yes. And while we have some questions coming in, we also ask that you look at our evaluation form. We would really appreciate it if you guys could fill that out from today's session. While we're waiting for people to talk, I got some more questions to ask, and it's kind of a little off topic, but Dr. Bolton, we do know, I know some women in my life who chooses not to use contraceptives, but instead they want to do natural family planning. So one, can you kind of talk about how to navigate that if they choose to do natural family planning? And then Tyler, does Planned Parenthood offer, I guess, counseling when it comes to natural family planning? Sorry,
So natural family planning is going to be most effective with people who actually have a regular cycle. And that's how you're going to be able to predict when your ovulation is. And so there are different keys to when you're ovulating. Some people feel it, feel the actual ovulation pain. And then you notice a change in your cervical mucus, and some people monitor their body temperature, and then there are ovulation test kits. And so that's the main thing around natural family planning, is to avoid intercourse, unprotected intercourse during ovulation. And I know people have, heard about not ejaculating inside the vagina, and that's another method. Of course, they're not as reliable, but it is something that some people do. The other thing that's kind of a natural method is women who are breastfeeding. Breastfeeding kind of serves as a birth control method too within the first 6 months, because when you're breastfeeding, that increases a hormone called prolactin, and that helps to inhibit ovulation.
I have a question. It's about a misconception that.
I was gonna respond.
Someone.
Yeah,
Sorry.
yeah, we offer support for folks navigating natural family planning.
Okay.
But yeah, that's all the stuff Dr. Bolton said.
Okay. There you go.
I'm so sorry. But this ran through my mind. So as young women, we hear a lot of things about birth control. So we have a gynecologist on here. Are we supposed to take 2 pills if we skip a day?
It really depends on which pill you're on, but generally your pack should come with an insert that tells you what you need to do if you skip 1 pill or 2 pills. So generally, if you skip 1 pill, then you're going to take that pill as soon as you remember it, and then take the pill that you're supposed to take that day. So the short answer is yes. But if that is happening often, then we need to find you another method.
I feel like I'm getting PTSD. I feel like I just heard this conversation 3 weeks from my OB. Sorry,
Yeah. You need another method if you're having to do that quite often.
When you look at the pack, you see dot.
Oh, that is my downfall. Like
it leads to,
4 days.
that can lead to irregular bleeding too. So if you're starting to skip pills, then a lot of women will start to have irregular periods and have breakthrough bleeding.
I gotta be stopped.
Do we have anybody want to ask any questions? Anybody want to unmute themselves?
I just want to say thank you to both Tyler and Dr. Bolton. This has been some great information, and I appreciate you all supporting and lending your knowledge and expertise tonight.
Thank you for having me.
That's our CEO, y'all, of 6 Dimensions. Yes. Thank you so much, Dr. Burris.
Thanks, Dr. Burris. So I don't think we have any questions, but if you guys do have any questions, feel free to email 6 Dimensions. I have dropped both Tyler's and Dr. Bolton's contact, so Instagram, email. I'm not sure if you guys want them to contact you if they have any questions. I'm pretty sure Dr. Bolton will say if she doesn't reply her email, just come be a patient. So I'll do the same with my OB. Like, she don't answer my phone calls, I'm gonna go to her office. I'm gonna talk to her there. But yes, and like I said, we would really appreciate it if you guys could fill out an evaluation. And this way we can give you all the information from this event, as well as your giveaways. We do have one question. I heard that when men ejaculate in women, it throws off the pH balance. Is that true?
It can. It doesn't always happen, but it absolutely can.
Got you. All right. So I believe that's it. Tierney, you want to say any last word? Dr. Bolton.
Hey, I just wanted to mention that if anybody has any other questions just about birth control, the acog.org is a good source for just like very basic layman terms, patient-centered questions. And so if you go to that, like, and just type in birth control or contraceptives, there's a lot of good information on there too.
And that's acog.org.
Mm-hmm.
I'm pretty, okay, Tierney got it. Because I was about to link it. Thanks, girl. Okay, then, well, we want to thank everyone again. We're gonna close it out tonight. We will see you guys next month for our session, as well as in December. So yeah, thank you guys for joining us tonight. We hope that you have a great night. Thank you again, Dr. Bolton and Tyler. We appreciate all your wisdom from tonight. So have a great day. And Dr. Bolton and Tyler, if you could stay on, we really appreciate that.